Okay, so first of all, thank you for the invitation to the conference. And before I start, I want to mention that this research project is funded by the IBS. So thank you for the grant we got for this research project. So the whole project is about economic uncertainty and the future, the long-term consequences of economic uncertainty at the beginning of the career. And in this project I'm presenting today, we focus on fixed-term employment and how this fixed-term employment affects fertility and health outcomes of the young generation. So this is joint work together with Natalia Danzer. She's also at the IFO Institute in Munich. Why do we care? Actually, this question is not an open question. We saw a lot of slides and a lot of evidence why this is really a problem in the first session. And in many European countries, and in particular in Germany, the prevalence of fixed-term contracts increased rapidly over the last years, so especially the last 10 years or so. And just to give you a number, in 2012 we had almost every second new contract in Germany with a limited duration. So that means that every second new contract is a temporary contract. And this especially affects the young adults which just finished their education, enter the labor market, because they are looking for a job and they get a new contract, and the probability of getting only a fixed-term contract is really high for them. And the literature already knows something about the labor market success of starting a career with a fixed-term contract. So there is this literature out there about the stepping stone hypothesis, but if it comes to other or spillover effects to other domains in life, then the literature is quite scarce. So we don't know a lot about the effects on fertility and mental health and other outcomes. And the two things I mentioned here I will focus on in this talk, namely fertility and health outcomes or well-being, and how they are affected by starting a career with a fixed-term contract. From a policy perspective, this is a really important research topic, because in the public debate there is always this causal link between the precarious employment arrangement of young individuals and the low fertility or the mental health problems. But if you look at the literature, it's far from clear whether there is really a causal link between these two phenomena. And that's why we ask in our research project, what are the short to medium run consequences of starting a career with a fixed-term contract? So we really focus on the type of the first contract, and we only look at individuals who start their career with a fixed-term contract and compare them to individuals who start with a standard permanent contract. Our contribution is, first of all, that we are the first to look at the fertility effects and the mental health effects of starting a career with a fixed-term contract. And we not only look at the timing of fertility, so we not only look at the temporal effect of fertility, but also at the quantity effect. So we also look at the number of children and how they are affected by fixed-term employment. And one other thing, and which is not common in the literature, is we discuss the problem of selection. So there's a lot of literature already showing correlations, and we try to make a statement about how can our estimates be interpreted as causal. And finally, the last point is that we also look at different subgroups. So we do heterogeneity analyses just to show which are the subgroups, or which are the individuals who react strongest to economic uncertainty at the beginning of the career. So this is actually a completely empirical analysis, so that's why I directly start with my data and the sample. So we use German data, and this is data from the German socioeconomic panel. This is a quite large national representative data set, and we use the waves 1995 to 2012. And we have to do some restrictions for our analysis, because we want to know who are the individuals who start with a fixed-term contract, we have to observe them when they graduate or enter the labor market. So this is our first restriction. So we only look at individuals who are in the data, who are in the survey or answer the survey when they enter the labor market. And then we want to follow them in their first years of their career, so 5 to 10 years after their labor market entry. And therefore, they don't, they have to be in the sample for at least 5 or 10 years. If we look at the fertility outcomes, then one restriction is that they have to be childless at labor market entry and they have to be in reproductive ages. So this is basically our samples. At the end, we have a balanced sample of men and women starting their career. So they just finished their education, their vocational training, or they get the university degree and enter the labor market, and then we follow them for the first 10 years of their career. Our outcomes variables we are interested in are first a set of the probability of having had a first birth until year set after labor market entry. So that means we look at the individuals at the different points in time after their labor market entry, and then we want to know, do they already had their first birth? So for example, at year 5 after graduation, are they already parents or are they still childless? And if they are parents, then the variable has value 1 and otherwise value 0. Then we create a set of variables which indicate the number of children, again in every year after graduation. And finally, for our health outcomes, we use indices and the life satisfaction of these individuals, again measured in every year after their labor market entry. And for our regression, we also need a right-hand side, and these are our right-hand side variables, so the explanatory variables we have in our analysis. The most important one is this here, the dummy for a type of the first contract, which takes on the value 1 if the first contract is fixed-term contract and 0 otherwise. And then we have a lot of control variables, and all the control variables have in common that they do not change over time because they are either predetermined, so these are all characteristics which are determined before graduation or before entering the labor market, or because we measure them at the labor market entry. So first job characteristics, for example, are measured at the same time as our main explanatory variables, so when they enter the labor market. Finally, we also have some information about the health status before entering the labor market and the partnership status. So this is a technical slide and we'll be really brief on this. This is just the estimation equation. It's a standard linear form where we regress the outcome variables here of individual I in year T0 plus C. So set years after graduation. This is what the plus C here means. On the right-hand side, which is always the same and consists of the dummy for first job is a fixed-term contract, dummy for unemployed after graduation, so that means that our base category is a permanent contract. And then we have the control variables measured in T0 and federal state and year of graduation fixed effects. For the different outcomes, we use different estimation strategies. So for our first birth dummy, we apply a probit estimator. For the number of children, we assume a Poisson distribution, and finally for the indices of mental and physical health, we apply ordinary least squares. So let me come to the results. I try to explain to you how you can read the table. So these are all coefficients coming from separate regressions, and these are all the coefficients of starting a career for fixed-term contracts, our main explanatory variable, but in different setups. And the outcome variable is probability of having had a first birth. This is the sample of native women. It's because women are more interesting than men, so everything what is going on in a sample for women. And from going from the left to the right, we just add more control variables. It's just to show you that the estimated coefficients are quite stable and not changing with introducing more control variables. It's more interesting to go from the top to the bottom. We are we're changing the outcome variable and we are proceeding in time. So this is measured the outcome 3 years after graduation, 5, 7, and 10 years after graduation. And what we see is that, yes, after some time, so that means there's nothing going on 3 years after graduation, but already 5 years after graduation, we can see some significant negative effects. That means that we have a lower probability of a first birth after the individuals, or in this case, the women, entered the labor market. And this seems to be quite stable. We can also plot this to make it graphically more, this is just the specification in the last column with all the control variables included, and we can see that this is quite stable over time, a negative effect. And if you want to interpret the coefficient, then it's around 15 percentage point larger probability of having had a first birth, and it's quite stable over time. And now we want to know, does this lower probability of giving first birth also translate into a lower number of children? And the answer is yes, but not as pronounced as in the case of first birth. So we again see negative significant effects, but not for all estimations. And again, if we plot the last column with all the control variables, then we can see that this is like an increasing effect over time. So the stable negative effect on first birth seems to translate into accumulated negative effect on the number of children. And at the end, so 10 years after graduation, if you start your career with a fixed term contract and you have about a quarter of a child less, and I think it's quite a large effect. So finally, we look in this research project at health outcomes, and to make it short, the health outcomes do not show so much interesting results. Actually, there's nothing going on for physical health and also for job satisfaction, which is quite interesting because literature in most of the cases find negative effects on job satisfaction. But if we look at mental health, then we can see that there are some negative effects, at least at the beginning of the career. So in a very, very short run, we can see that these people who are probably still in their first contract, in their first fixed-term contract, they feel a little bit depressed or a little worse off compared to their permanent peers. Okay, so this is just the first column, the mental health, plotted again over time, and we can see exactly that here the effects are the strongest and then they are fading out over time. I said one contribution is that we at least discuss the selection problem, and we don't have a proper solution to the selection problem, but I think that we have some features in our research that we can at least say that we have quite robust correlations which might imply a causal effect. Of course, we have the problem of selecting of different types of workers selecting into fixed-term employment, and we cannot control for all characteristics of these types, and therefore we might have an omitted variable bias. So every coefficient I showed you in the tables before might be interpreted with caution because there are probably some omitted variables, but we also use some features in our research which make us really confident that the estimated effects are quite robust. First of all, compared to other studies, we focus on the type of the first contract. So this is not changing over time, and the endogeneity is not so large like looking at contemporaneous holding a fixed-term contract. The second point is that there was a really, really large increase in fixed-term employment, and really sharp increase in fixed-term employment in Germany, and this is mainly demand-driven, so from the employer side and not driven by the employees side or by the characteristics of the employees. And therefore we think that if we look at the fertility decision of employees or of employees, then this should be exogenous, at least to some degree, this sharp increase, and therefore the larger probability of starting with a fixed-term contract over time. And finally, and I know this is not a completely valid argument, we have a lot of typically unobserved characteristics, so we can control for a lot of traits like risk aversion or the big 5 personality traits. And we also have some quite good proxies for family preferences. So people are asked in the survey how important is family or how important is career, and we can control for such preferences in our analysis. So let me conclude. We find in our study that starting the career with a fixed-term contract delays first birth. So there's a postponement of the first birth, at least for women. We have also some evidence that this translates also in a lower number of children. I didn't show you the tables for men and also not the heterogeneity analysis, but I can tell you that men are not affected as much as women. And we can also show that some educational levels, so most affected are the secondary educated women. So women with just a vocational degree and not a university degree. And we also can show that natives react stronger than migrants to economic uncertainty like fixed-term employment. For the health outcomes, there's only an effect in the very, very short run, and there's no long-lasting effect of starting a career for fixed-term contract, at least in our sample. So my last slide is on policy implications, because I think the focus of this conference is more on the policy implication of our research. The first points are more or less a summary of the last slide. So fixed-term contract lead to dual labor markets with negative consequences for the affected individuals. And we know actually quite a lot about the labor market consequences of these individuals, but we try to shed light on the consequences of other domains of life, like fertility, and we show that there is delayed first birth and lower number of children, and also on well-being and health outcomes, and we show that at least in the short run there is a lower well-being or lower mental health for affected individuals. Now the large problem with this fixed-term contracts from our point of view is that it only affects a really small subpopulation. So only the people with a fixed-term contract are really affected by this policy, and they have to carry the burden, whereas all the permanent employed individuals do not contribute to the flexibilization of the labor market. So they still have their employment protection and really high firing costs. But some people at the margin who are just employed on a fixed-term or temporary basis, they completely have to carry the burden. And therefore, we argue that policymakers should possibly reconsider the costs and the benefits of the labor market policies. And actually, they should strive for a more equal distribution of the costs. And this could be potentially be by lowering the employment protection for the whole population, of the whole working population, not only for a small group of this temporary employed individuals. So that's it. Thank you for your attention and your comments.